Hello, I'm Dr. Bluth, and I'd like to welcome you to this brief conversation between myself and Tim Lyons, our new CEO. Tim, welcome.
Good to be
here with you this afternoon, and hopefully we'll get this done in a way that won't mess the whole thing up. We'd like to spend a little bit of time just talking about all the things that have happened here at Southwestern Eye Center over the last year or so. As you all know, there's been a lot going on. We've had this big project of regionalization. We've had the IT system going to next gen. We've had preparations for ICD-10. We've had preparations for the new AAAHC survey, and it goes on, and those projects are kind of unending. But it's nice to know that we have a good steady history, we have a good organization, we have a good administration, and most importantly have a wonderful staff that takes care of patients.
You know, Dr. Bluth, looking at the environment, at the way it's changing, and going forward with the company, there's a lot of demanding things that are taking place out there. And we're focusing on that. One of the most challenges that we have is to make sure that we're changing with the environment as a company as well. And going forward, everybody wants to know where we're going. And what we've decided to do is develop a 3-year strategic plan of moving forward. And each year is going to have a detailed plan, capital improvements, everything that we're planning on doing for that year. We do have some offices that are not performing very well, and we've actually in the process of closing 4 of them. The Village of Oak Creek, Green Valley, Lakeside, and also Santa Teresa. We've also made some challenging decisions in the administration building, and we've cut some staff there, and going forward, we'll probably make a few other adjustments across the company. But one thing that we need to focus on is that we're improving. We're getting better as we're going forward. But our number one goal is to make sure that we take care of our clients, our patients, and also to make sure that our staff and the providers, that they're satisfied in their careers as well. Mm-hmm. One thing also that we're doing is we're focusing on career development, making sure that all the staff have an opportunity to lay out a plan where they want to go in their careers, and then we'll help them get there, providing training for them as well. And also looking at performance. We need to perform as we go forward, each and every one of us, Dr. Bluth. But I'm excited. We're making some changes, but we're moving forward in a positive direction.
Well, there's a lot to be done, and it is a very complex organization. I've always jokingly said that healthcare is really a simple business, because all we're really doing is taking care of people's vision and making it better. And our responsibilities at Southwestern Eye Center is to enhance, to protect, to preserve, and to do everything we can to make people see better and to keep them seeing well. There's no gift in life that we have that's important as our vision. And if you talk to anyone across the board, they'll always say that that's the one thing that they'd hate to lose more than anything else. And so we have this wonderful privilege of being able to make people's lives better. But it takes a lot of resources to do that. And when you look across the organization, we have our doctors, we have our nursing staff, we have our technicians, we have our office staffs, we have surgical staffs, we have administration, and we have our insurance people, we have our IT people. You know, the list goes on and on about the number of people that we have that have to help us do that. In addition to that, we also have to have all of our facilities, we have to have the buildings, we have to pay rent for those, we have to have all the equipment that we need, we have to have the surgery centers, and then all the optical facilities. We have to pay for the transportation. And so to keep this organization running, it takes quite a bit of money to do that. And there's really only 3 sources to get that money from. One of those sources is the professional fees that the doctors, our ophthalmologists and our optometrists receive for their professional services. We also have our nurse anesthetists that get professional fees for what they do. Then we also have the optical fees that are generated. And thirdly, we have our facility fees. So to cover all these expenses, those are really the 3 most important resources that we have to help them. And we are somewhat concerned because in our 30-year history we've done very well, but this last couple of months it's not gone quite as well. And as we look back and try to assess why it's not gone as well as we'd like it to do, it seems that it's because we've not kept the appointment schedules as full as they need to be. And I've always said that an appointment schedule is just like an airplane with a seat in it. If you don't fill that seat, then you've lost revenue. And so one of the most important things we can do as members of Southwestern Eye Center staff is to make sure that every doctor's schedule is filled every day. Let's not wait and make sure that it's filled 2 or 3 months from now. Let's bring those patients in tomorrow and make sure that the doctor's appointment schedule is full every day. That's a very important thing.
You know, Dr. Bluth, that's a great point that you bring up, because we're focusing on a program to make sure that we go out to all the communities and we reach out to all of our referring doctors and providers to make sure that those appointments are filled every day, and let them know how much we appreciate them as well.
Good. You know, in the past, Tim, we've talked about having a 5-year plan or a 10-year plan, and I think those are a little too far out with all the rapid changes in healthcare. I think that your idea of having a 3-year plan is really good, and we've had a lot of conversations about what you've put in those plans. I know that you plan to share those with our staff at our all-staff meeting.
You know, we develop a draft plan, as we've shared with several of us on the governing board, but during the all-staff meeting in April, we want it to be transparent. We're going to present it, get feedback from everybody, and then when we finalize it, it'll be on the internet like we had mentioned, so everybody will know where we're going and the direction that we want to go as well.
Oh, that'll be great. I think people will have some real buy-in when they understand what we're trying to do as an organization.
Also have some participation in the development of it as well.
So Tim, there's a lot going on in the organization, needless to say. I'm excited about the plans that you've brought to us, and I'm sure that when I come back in 3 years, you'll have it all ready to go. I'm excited to see all of you at our all-staff meeting in April. It'll be fun to see you all there, and I'm looking forward to having Tim and his organization look after things in my absence, although I will be involved to the degree that they let me do that. So, Tim?
You know, I'm excited. It's a great company, Dr. Bluth, and I look forward to working with each and every one of you to make it even better going forward. Thank you very much for your time.